and thank you for the opportunity to present this presentation. I remember the day Professor Pepper called me to tell me I had received an Ethicon scholarship. I think it was about 6:30 on a Sunday morning, but it was a very important phone call for me to get, and I'm very grateful for that. It's been the most enjoyable, rewarding, and productive 6 months of my surgical training to date. My primary objective was to expand my primary operator experience in mitral valve repair and learn more about minimal access mitral techniques. The most important aspect of my fellowship was that I could manage my own time and for the first time really tailor my learning needs to my subspecialty interests, which was the mitral valve. Now, I wanted to maximize my primary operator experience. 6 months is not a lot of time to spend in a unit, and I needed to be sure that I was spending time with people that could train me. And so I designed my own plan. I already have a trainer-trainee relationship with Steve Hunter in Middlesbrough, which is where I've spent most of my training. So I decided to spend the majority of the time with him, but as a supernumerary fellow in Middlesbrough. I then moved on to spend 2 weeks with Hugo van Ermen in Alts. As you know, he really is the godfather of mitral minimal access surgery, to consolidate techniques that I will have learned with Steve Hunter. And finally, I spent 2.5 months in Lyon with Professor Obadia, who is the lead minimal access mitral surgeon in France. Now, with Steve Hunter already having a trainer-trainee relationship, knowing the hospital, I rapidly got up to speed with all the open mitral valve repairs and atrial fibrillation and more complex multi-valve procedures. And I was primary operator for all of those during the time I worked with him. In terms of the minimal access techniques, we deconstructed the whole process. There's a lot of parts of a minimal access mitral surgery, and we deconstructed it into what we thought were the most important component steps, and went on an iterative learning program on each of those so that I built competences in all of those separately prior to putting it all together. In addition, I had my own transthoracic echo clinics. I wanted to learn everything about mitral valve surgery in terms of assessment, postoperative care, and intraoperative management. So I had my own transthoracic echo clinics where I did my own echo, went to echo MDTs, and I got a lot of hands-on experience with timetable time with the cardiologist and anaesthetist with TOE. I also, because I was managing my own time, I managed to spend some time with Professor El-Khoury in Brussels in his wet labs, and I also had time to go to meet Professor Cox and learn subspecialist atrial fibrillation techniques from him. Now in Europe, I went to work with Hugo van Ermen. His hospital is that picture in the top left-hand corner. He likes to think that they designed the hospital after an anterior leaflet of the mitral valve. I'm sure that's an accident more than design, but it's a big, primarily private hospital, but they do a lot of public work, but it is a state-of-the-art facility. They have robots littering the corridor, and what I learned from him really was all the tips and tricks that he has built up since 1995, since he's been doing this procedure. He's got a fantastic team around him. The scrub nurses and the perfusionists know more about this procedure than I've ever known a team to know. And it really brought home to me how important a team environment is in this kind of surgery. This is Lyon. The sky is normally that color there. It was a brilliant time to go at that time of year. And I worked with Professor Obadia. His technique in mitral valve surgery is slightly different from Hugo van Ermen, and it was really interesting to see the small differences he makes. He uses a Chitwood clamp rather than an endo balloon. That's a common point of discussion for those of you involved in minimal access mitral. He uses completely percutaneous bypass, and also I learned some endovascular closure techniques from him. Now, in Lyon, they used to break for 2 hours every lunch, and we used to go out and have a sit-down lunch, either in the hospital or outside the hospital. But this side is really to remind me that every night before I went home, I used to check the operating list, and the operating list for the next day was like a Michelin star menu for mitral valve surgery. There was always 130, which was stenotomy mitral valve cases, and 130, which was minimal access cases. And there was a whole gamut of rheumatic, ischemic, bileaflet, single leaflet, endocarditis every single day. It was just fantastic to be part of. Now, while I was there, unlike in Belgium, the French insist that you speak French. And although my French is okay, I had to really work hard on it to keep up to speed with everybody going there. And while I was there, Professor Obadia did his 1000th case, and the equivalent of the BBC came to film. And I knew my French had got up to speed because I managed to explain to them the whole procedure and the relative merits of minimal access surgery in French. And to my amusement, I hope the audio doesn't play, but to my amusement, I ended up on French national TV talking about minimal access mitral surgery in French. So my primary objective was to become, to expand my primary operator mitral valve experience. I did that, and I did over 35 cases with Steve Hunter, just mitral valve, including complex multi-valve procedures and atrial fibrillation surgery, in addition to the usual revascularization that comes in a unit. One of the most important things I learned was the importance of teamwork in developing a comprehensive program, whatever type of surgery you're interested in. For me, it was mitral valve, and the individual responsibility for quality that comes with that, as every single member of the team was with Hugo van Herman. It is a challenging type of surgery to learn, and I'm very grateful that I managed to get experience and good teachers to learn from. This Ethicon scholarship was a complete game changer for me. I have got a substantive position since I started the scholarship, and I know the scholarship was an important aspect of making me feel ready to take on a consultant job. I am very grateful to Ethicon and the Society for administering this, but I also do have to give a nod to the other industry sponsors that enabled me to go and work in their laboratories in Europe to learn how to use long-shafted instruments and use their wet lab facilities and simulation over in Europe. Thank you very much.